Challenges with telehealth. With a lot of challenges, healthcare is there to facilitate and balance best practice patient care. Pandemic has also made it important to think about life in a different manner. Telehealth grabs attention to these situations. Pandemic has pushed telehealth forward and it makes telehealth a consistent need with the improvement in technology. Reasons to make telehealth an essential part of life. There are many reasons to make telehealth essential in our life that will enhance our mood and will bring positive thoughts. There was a survey in the US that the patient had highly recommended telehealth due to its positive impact on their mindset and their frame of mind. The quality of telehealth is the same as in person visits because it is easy to access and scheduling makes the process comfortable. The main reason also counts here is that it makes patient easy to get an appointment from a trustworthy and well-reputed department and increased patient flexibility while getting an appointment from the doctor. There is a lot of barriers and demotivation for the client like travel time, personal barriers, time of work, childcare. Telehealth had reduced these hurdles where smartly had reduced the stress. For the patients, it is very well utilized in emergency situations. Virtual visits had helped many children as well as improved self-management and had get treatment of medical advantages. It also reduced the burnout that people face while waiting for their appointments in critical conditions. It also helps patients in balancing their work, life, and healthcare. Conceit for easy patient follow-up. There is advancement in treatment on the regular basis and people can make their choices easily. Telehealth remote care options and provide consultations. Many chronic diseases like heart patients books their appointment and by many tools get their medical reports and gets proper care that is required for them in the treatment. Digital symptom calendars give the diagnosis and people get benefit from the treatment and also recover rapidly. Telehealth like this reduces the risk of infections and make the decisions by the care team about patient treatment. Many apps and services are working on it and make it easy for patients to get daily care for their health. Telemedicine provides the care. Telemedicine helps in a lot of ways to provide the care including general health care with a wellness visit, prescription for the visitors, nutrition counseling, and many more. Telemedicine is utilized for health services and primary care is given to allergies, asthma, colds and flu, infections, diarrhea, etc. Telemedicine is spreading all over the world and it is also a new concept and it is developing in the world of the internet. It contains a virtual connection and it is improving with the time and make it viable. Now trends of telemedicine. Today telemedicine is changing faster than before. Technology is getting advanced and telemedicine tools are also getting advanced. The US population uses the video apps like Skype and has the access to use them on computers and mobile phones. Telemedicine is a convention tool. Major issues were going on that people were unable to get the facilities of medical treatment and were living away from local healthcare departments and now people getting immediate response and get their treatment for minor issues whenever they need it. Telemedicine is giving a way to medical practices to maintain a good health. Patients are now used to apps that track their health and gets their diagnosis report. This similarity between telehealth and telemedicine, it becomes complicated to analyze the difference between the terms. Both terms are used interchangeably and give the same services that are medical education, health wireless applications, patient consultation via video conferencing. E-health patient monitoring. Telehealth has all health related services by using telecommunication technology and telemedicine is the clinical service. Telehealth provides healthcare and health education and helps the public by using telecommunication technology. Telemedicine is giving us medical services. I see an example to compare both. If there is a message about the disease by public health app, it covers in a telehealth or a video conference. On medical education, it comes in telehealth, and if a mobile app gives a physical treatment, it will be a telemedicine concept. Best telemedicine medical specialties. Medical fields are covered in telemedicine and have a consulting patient. There is a shortage of care and limited access to rural areas, and telemedicine is useful to any healthcare provider. There are a lot of solutions made by doctors and give the key niche to telemedicine specialties. There is work on behavioral health services. If we see the dermatology gives the healthcare to patient and send them photos of rash, a mole and spots the potential problems. Teleophthalmology allows ophthalmologist to check the patient's eye and treats the eye infection from a distance. Upcoming news of telemedicine. There is a lot of optimistic news about telemedicine. As there are rapid changes in technology, it is assumed that telemedicine is more widely accepted. Smartwatches are there to detect the illness of a person, and apps that tell the emotional state of a person and monitor their mental wellness. So the telemedicine future is bright and more demand with top trends of telemedicine. With the passage of time, telehealth is upgrading its system.